Your textbook has a well-written but brief section on breastfeeding. Our video notes this week will expand on that a bit as we explore the benefits of breastfeeding. Other than for a few specific medical issues, such as a mother who tests HIV positive or who is taking a seizure or chemotherapy medication that secretes through the breast milk and could be harmful to the baby, nearly all women are biologically equipped to produce milk and to be able to breastfeed. Breast size has absolutely no bearing on the volume of milk production. The majority of the differences between breast sizes is related to the amount of fat tissue in the breast. We'll start with a little anatomy to help us understand the process of milk production. The alveolus glands deep in the chest wall are the site of the actual milk production under the stimulation of the hormone prolactin. As the baby nurses, the hormone oxytocin is secreted in the mother, which triggers the alveolus glands to secrete the milk to travel through the ductules to the sinuses and out through small openings in the nipple. There are many benefits for breastfeeding for both the baby and the mother. Some of these include the fact that breast milk is the perfect balance of nutrients and immunities for the human baby. Half of the immunities that the mother provides the baby come through the cord blood, and the other half are delivered through breastfeeding, especially in the earliest days following birth. The breast then goes on to make milk that is tailor-made for the baby's environment, complete with immune system support. For example, if the mother is exposed to a particular virus or bacteria where her immune system mounts a response in the production of antibodies, the baby will receive some of these disease-fighting antibodies at the very next feeding. The nutrients are specifically designed for the human baby as well. I always ask students what a baby calf needs to do to survive. The mother cow isn't going to pick up her baby to hold it and feed it. The baby needs to stand, walk, and follow its mother to survive, and soon to be able to run from predators. Components in cow's milk are perfect for muscle development. The human baby doesn't need to walk and follow its mother, and in fact won't walk for nearly a year after birth. The most immature part of a human baby is its brain. If the brain was any bigger or more developed at birth, the baby would not be able to navigate the birth canal and could not be born. Human milk is the perfect blend of nutrients for developing the brain. If you have any experience raising cattle, especially dairy cattle, you understand the value of colostrum, which is the thicker, sweeter, and more yellow first milk that mammals of all species secrete. For calves, to a great extent, their very survival depends on receiving the immunities in this early milk. Human babies do better as well when they have the benefits of this immune-rich early milk. While a small percentage of babies can be so sensitive that they even react to allergens in the mother's diet, such as cow's milk, it is not possible for a baby to actually be allergic to its own mother's milk. Unlike the number of babies who are allergic to cow's milk and formulas and must be switched through a whole series of formula variations to find one that works for them, often through much discomfort and a great expense. A friend of mine with a health issue that prevented her from breastfeeding was sharing recently that her baby had lost weight and was spending a large part of the day crying incessantly while they were trying to find a formula that would work. In the end, it was a hypoallergenic soy-based formula that is costing her $150 per week to purchase. It is hard to beat the convenience of breast milk that is always available in the right amount and at the correct temperature. Breast milk is produced on the principle of supply and demand. While the human body produces very amply at the beginning, to the extent that mothers of twins and even triplets can have enough milk to feed their babies, fairly quickly the mother's milk production settles in to match the supply to what the baby is consuming. As the baby grows and consumes more, the mother's body matches the need. I always like to throw this one in because who doesn't appreciate the fact that there is really no offensive smell to the diapers of a fully breastfed baby. Once other foods are introduced, or if formula is introduced, the smell that we associate with diapers will be present. In addition, breast milk is digested so fully that there are fewer poopy diapers. As we talked about earlier, formula, depending on how specialized it is definitely more expensive. A number of years ago, I had a mathy friend who had calculated it out to determine that she saved more than the amount of a major appliance by breastfeeding each of her 4 children. Her husband agreed, and so she had her dishwasher baby, her professional grade cooktop baby, and her second refrigerator baby. It is not possible to overfeed a baby at the breast. When they're full, they stop eating. In addition, since there is no overfeeding, there is no new fat cell development. This is an important factor in preventing obesity. We are all born with a certain number of fat cells, which can shrink and grow. Through our diets, we can acquire new fat cells. These cells, once we have them, can shrink and grow but never really go away, barring bariatric surgery. Breastfed babies also have many fewer illnesses, and they are rarely constipated. The process of breastfeeding supports a special closeness and bonding between the baby and the mother. And it is a great confidence builder for the mom. Breastfed babies are typically healthy and thriving, and the mother knows that it is due in large part to the nutrition she is providing through her breast milk. Prolactin is known as the mothering hormone, and it's generally only present in lactating women. It produces a calming effect in both the baby and the mother, which is wonderful for relaxing them both as they adjust to life in the early weeks with a new baby. If anyone has spent time around chickens, that include roosters, you may have some understanding of how the term cocky came into being. Roosters typically have 2 things on their mind: looking and sounding cool, and fertilizing the eggs of as many hens as possible every day. There is nothing nurturing or motherly about a rooster. A study was done where prolactin was injected into roosters to observe the effect. These roosters almost immediately began to behave in nurturing ways, looking for food and calling the hens and baby chicks to come and eat. I tend to be pretty high energy and struggle to sit still and quiet, and I always said the calming prolactin in my system was one of the things I missed most when my children were weaned and no longer breastfeeding. Breast milk provides a myriad of health benefits to the baby, including decreased incidence of diarrhea, botulism, meningitis, diaper rash, ear infections, urinary tract infections, lower respiratory infections, and chronic digestive disorders. It also provides a lifetime risk reduction in the incidence of leukemia, lymphoma, allergic diseases, Crohn's disease, diabetes, and asthma, and both childhood and adulthood obesity. There are also some significant health benefits for the breastfeeding mother, which include losing pregnancy weight faster, having the uterus shrink back faster and with less bleeding following birth, and fewer mood swings, as well as lifetime risk reduction for osteoporosis, breast cancer, ovarian cancer, and uterine cancer. And this risk reduction increases with increased duration of breastfeeding, usually measured in months, and across all the children she breastfeeds. So the longer she breastfeeds and the more children, the greater the risk reduction for these cancers and osteoporosis. Research continues to confirm that breast milk provides the best nutrients for brain growth, and in fact, there are controlled studies that show babies who are breastfed for a minimum of 4 months gain 8 IQ points on intelligence tests, and that breast milk is easier to digest with more complete digestion and less waste. Currently, the American Academy of Pediatrics recommends breast milk with no additional juice, foods, or water for the first 6 months. They recommend breastfeeding for at least the first year. The World Health Organization recommends breastfeeding for at least the first 2 years. While these next slides pertain primarily to parents, it is important for us to think about the factors that most support breastfeeding success if we want as many children as possible to benefit from being breastfed. The number one factor in study after study has to do with the support and attitude of the mother's parenting partner. If that person is supportive and in favor of breastfeeding, the baby's mother is much more likely to breastfeed successfully. Being knowledgeable and informed and having a sincere desire to succeed are also key factors. And finally, it can be helpful to have the support of friends and close family members, especially those who have successfully breastfed their own children.